October is Breast Cancer Awareness Month, and concerns have been raised about the prevalence of this cancer among the pre-menopausal women. A South African study reported that the average age of breast cancer diagnosis for women under the age of 40 was 34 years, and it was also revealed that younger women are diagnosed with more aggressive forms of this disease. For more on this, I'm joined by Dr. Carine Kabanga, who's a member of the Breast Imaging Society of South Africa. Doc, good to have you on the program this evening. Thank you for joining us. I want to begin with the recent data. We're seeing an alarming rise in breast cancer cases among women under the age of 40 in South Africa. What's contributing to this trend, and how concerned should we be?
Thank you for having me on your show, and good evening to you and your viewers. Unfortunately, we live in a country which we have poor resources in order to diagnose breast cancer. Well, it's still early stages. So that's the biggest contributor to the rise in breast cancer. It's late presentation, and it's late presentation because Gogo in rural KZN or rural Limpopo cannot get access to medical care in time, so that we can save her life and the breast. And another contributing factor is once we diagnose, patients have to wait for a long time in order to get surgery, in order to get oncology. And as we know, pathologists are also overwhelmed with the amount of cases that they need to diagnose, especially in the public sector. Very few specialists, and with breast cancer, it's a multidisciplinary team that needs to combat the disease. So resources are very scarce, and we have to deal with what we have.
Yeah. Your organization, the Breast Imaging Society, is calling for earlier risk assessments. What does that actually involve for women in their 20s or 30s, for instance? And how accessible are these tools in our healthcare system in the country?
I think, first of all, women need to be educated. So we need teams that will go in rural in areas that don't have enough resources. Teach women the basic thing. For instance, self-examination. If each and every woman should cover a breast examination monthly, you can do it by yourself. Feel your breast, know the texture of your breast, so that if there's anything abnormal, you'll be able to diagnose it yourself and say, this is not normal, I need to get to a clinic as soon as possible. Outreach programs. We need, like now, the month of October, breast cancer awareness all across the country, and reaching out to areas that will not normally have this. And we need partnership. I feel partnership between private and public sector in order to work together and help the people that cannot get access normally in private. We can get this done by having doctors in the private sector coming to help in the government sector, volunteering. Getting young doctors in the rural areas to know basic biopsy taking, so that we can expedite this patients actually knowing their diagnosis.
Dr. Carine, one of the key challenges remains late-stage diagnosis. Why are women still being diagnosed so late? And what needs to change systematically or even socially to catch these cases earlier?
I think the fear of the disease is still amongst our population. I think we need to educate people that cancer can be beaten, but you need to diagnose it early on. It is okay to have a cancer. Patients tend to go, for instance, in our Black population, you seek help with the sangoma. It's shameful to know that you have a disease. You consult family, you seek out other ventures before you present yourself to a hospital. Breast cancer can be beaten. It just needs to be diagnosed earlier on in the disease. So we need to educate people that You do not need to be ashamed. You do not need to be scared. You just need to present yourself as soon as possible.
One of your colleagues, Dr. Peter Schub, mentions that younger women are often diagnosed with more aggressive types of breast cancer. What makes these forms more difficult to treat, Doc?
First of all, the young female's breast texture is already different. So we learned in medical school that breast cancer was amongst the 60 and above. Now it has changed. With HIV, we've realized that a lot of the patients with HIV are presenting with breast cancer quite early, and it's an aggressive form, which is not, to put it in layman's term, it is very aggressive and it does not respond very well to chemotherapy. So HIV positive patients, we found that the prevalence is a little bit high in those patients. And another thing is, because, like I mentioned, the breast composition is different, it's a little bit more difficult to diagnose it, because those patients' breast density does not permit us to actually see the cancer with a mammogram. They tend to be more visible on an ultrasound, for instance, compared to a mammogram. And patients don't feel like I can have cancer. I'm young, I'm fit, cancer cannot happen to me. Unfortunately, things have changed. We're finding cancer in more younger and younger patients. Not just that, we find that women in pregnancy, there's been a very high incidence now from pregnancy-related breast cancer. And it's difficult for these ladies to know because they think it's nostalgia, which is just breast inflammation because of breastfeeding or whatever other reason, and they present late because they are not informed.
Thank you so much for your time, Dr. Kabanga, for that clear and empowering insight. Breast cancer doesn't only affect older women like we hear, it's increasingly a reality for younger South Africans too, but knowledge and awareness, as you've heard, and access to screening can save lives. Dr. Kabanga giving us her views on this as well.